Even as more states are trying to reopen their economy, a new PBS NewsHour NPR Marist poll finds that 77% of Americans worry about a second wave of infections yet to come. This comes as computer-based models suggest that the U.S. will pass its own grim milestone by June, 100,000 plus deaths. That higher projection is arriving even sooner than some of the models estimated just weeks ago. But models are not crystal balls. The work that goes into making them and their ultimate purpose is more complicated than you might be able to tell from the headlines. Miles O'Brien explains in his latest report for our series, The Leading Edge.
We live in a complicated world filled with more data than insight. Finding a path to clarity is not easy, even on a good day. And these are not good days. So how can we take a huge amount of data and make it understandable so we can see the future?
And you can't believe every number that comes out. But if we don't try to formulate our thinking about a complex process, then we'll be running blind.
Bets Halloran is an infectious disease modeler. She writes mathematical formulas that define the chaotic exponential spread of infection. A biostatistician at Seattle's Fred Hutchinson Cancer Research Center, she's part of the team that curates the Global Epidemic and Mobility Model, or GLEAM.
The GLEAM model is a big mobility model that can answer global questions.
GLEAM begins with the first infection in China and travels down the many paths of exponential growth, constantly calculating who is susceptible, exposed, infectious, and recovered. SEIR, or SEER.
You can structure it in many different ways, but usually when we talk about infectious disease modeling, that's the basic sort of meat and potatoes of what's going to be in a model.
But the model does not stop there. It factors in the entire global transportation network, including airline schedules and capacity.
So the question we were asking way back then was, where is it going to spread? If it gets into the United States, where would it go first? And once it gets in, then we could use GLEAM to look at the question of how much is it going to spread in the different places? Where is it going to go first? And then we predicted that pretty well.
Halloran and her team did accurately predict where COVID-19 would first surge in the United States. But as the pandemic wore on, the limitations of the models became more evident. After all, no one really knows how the virus is transmitted, who's likely to get sick and who won't, who's likely to die, who might have immunity. All those questions won't be answered until there's widespread testing. So in the meantime, the models muddle on, with sometimes dizzyingly confusing results. One of them, from Britain's Imperial College, predicted 2 million COVID-19 deaths in the United States. But that assumed no human response, no social distancing.
All models are wrong, but some models are helpful. And I think it's important to remember that.
Nearby, at the University of Washington's Institute for Health Metrics and Evaluation, they built a much simpler model that started with a specific question in mind. Did the healthcare system have the capacity to treat a surge of COVID-19 patients? Chris Murray is the director. He and his team wrote a model that, unlike many others at the time, factored in the human response to the pandemic.
If you ignore the behavioral response, you're going to massively overshoot. And so I think it is a reasonable strategy to try to look at models like the economists do, which build in how individuals, local government, state government are going to respond to the problems as they unfold.
So I'm sure you're interested in seeing all the states.
Producing speedy state-by-state results with consistently lower projections, the University of Washington model was frequently cited by the White House in daily coronavirus briefings.
And I think if you ask Chris Murray, he would
But the model initially assumed there would be widespread adoption of social distancing restrictions in the U.S. Once it became clear that wasn't happening, the modeling team went back to the drawing board, releasing a new version on May 4th. It now uses mobility data gleaned from cell phone usage to better understand how well people are complying with the expert advice.